The Health Watch, like we do every Wednesday morning when we discuss all of the topics that are trending in the medical world. As always, we're joined by Dr. Syed Hussain from Trinity Health of New England. Still talking about Men's Health Month here being June. We want to draw more awareness to loneliness. Certainly not a problem that just affects men, but there is a new study out that at least suggests there might be an impact of social isolation and loneliness that might be unique to men. Doctor, what's that all about?
Yeah, this is a study that was presented over the weekend at the annual Endocrine Society conference, Tim. And it's a study looking at mice. So there are two groups of mice. One group where mice are just solitary in cages for 4 weeks.
Right.
And the other cage has up to 4 mice. So the changes that were seen in those that were isolated, especially those that were male, meant something along the lines of osteoporosis where bones become brittle.
Yeah.
So more studies are needed in the human population, but we do know the impact of social isolation and loneliness, though. It impacts a whole bunch of different body systems.
Oh, yeah.
Leads to mental health issues. So this should be front and center.
Yes, and mice sometimes are a good analog. That's why they like to study mice first, but you can't draw definitive conclusions on that. So what would you suggest men to do to avoid being so isolated? It seems like a lot of the technological innovations these days that sound social, like social media, don't always lead to people being social.
That's right, a great point. I think that probably leads to more isolation. So getting back to the basics of spending time with your friends in person, putting those phones away when you actually are with family and friends, I think will be important. And also relying on some network groups, support groups for socialization.
Okay, let's talk about malaria. We now have 4 homegrown cases in Florida, 1 in Texas. The first homegrown cases, I guess, we've seen in 20 years. Of course, malaria does not spread from person to person. I think that's important to say, but how worried should we be that apparently it's out in mosquitoes?
So the general risk to the American population remains very low per the CDC, Tim. Now, in 2019, pre-pandemic, there were 2,000 cases annually of malaria reported in this country. All of them were travel-related. So what's concerning is the 4 cases in Florida and 1 case in Texas, none of them are travel-related. So, and this may be because of the extreme temperatures we're seeing. As we speak, there's a heat wave going on in Texas and Florida. Well, we need to keep an eye on it. Just in general, the precautions you need to take include bug spray, and also looking at any health advisories from your Department of Public Health related to mosquitoes. And healthcare providers need to keep this diagnosis in mind when they do approach someone with fever, headache, lethargy, and all that.
Right. Malaria has killed countless people over the centuries and eons, but it's eminently treatable these days, right?
Absolutely, but it needs to be detected and diagnosed quickly, though, because to your point, it can lead to death.
Yes, and it can happen fairly quickly, my understanding. Lastly, heat exhaustion, heat stroke, something that's omnipresent every year, especially when we're seeing these heat domes like out in Texas. It's a big problem, but it can happen to anybody, anywhere. And I guess in some studies it's happening a little more commonly these days, huh?
Yeah, I mean, last year was one of the hottest years on record, and we're probably going to see more of these instances where we have extreme temperatures, Tim. Nighttime temperatures usually dip. We're not seeing that right now. So Dallas, for instance, is going to be more than 80 degrees Fahrenheit for 6 nights in a row.
Yeah.
So it's really important that you take precautions, and when it's really hot in the afternoon, avoid the outdoors if possible.
Yeah.
If you do outdoor activities, bring them indoors. And so a lot of hydration is important. And if you're in a high-risk group, if you're elderly or a child, then it's important to take those precautions seriously.
Yeah, it's one of those things where I think you know what you need to do, but sometimes you can get into trouble when you're out there and not realizing that you're starting to overheat, getting to that heat exhaustion point.
Right,
you want to stop it there before it gets to heat stroke. Doctor, thank you so much for taking the time to join us like you do every Wednesday.
Sure.
We certainly do appreciate it.